Okay, the first question there was simply just where exactly is the spot, and it's pretty close to being right in the middle of the cheek, the gluteus muscle. It's going to vary a bit. I mean, poke around, but it's pretty well right in the middle of the cheek there. And the 45-degree angle was midway between going superiorly and medially, which would then basically mean like that, going like that, and also midway between going superiorly and anteriorly, which is about like that. So you put the two of those together, and that's about the angle you got, something like that. So that's basically what you want, and you'll typically find that you'll have to do this with an elbow in most people, and in some cases, even an elbow won't quite cut it. But you do the best you can there. Should we go for the
hit the other side, Doug, on the left side here, so that everyone who's behind you can see that clearly.
Relax there. Relax. How's that? There we go. Better from there? Yeah. How's that? Well, it definitely takes to just the height of the table.
Mike?
As far as being, the question was how long could you stay in that position holding the point? And it would make a huge difference adjusting the height of the table, because it's going to be much harder if you're all hunched over or all crouched down or something like that. So you do want to try to get into a position that's going to be reasonably possible for you to maintain there.
Mike, please.
If you've got a lot of people holding points and they're all different heights, then, I mean, what, you're going to have the table like this?
It can be a bit of a challenge sometimes. You try to make the most people comfortable you can, I guess. One other situation on the spine that we should talk about, there's what's called an anterior displacement, which is where one of the vertebrae is displaced towards the front of the body. So if somebody, can you just hold a couple hands up there like this for me? Just stand up. Okay. Let's say, come around this way so the camera can get you and so everybody can see you. Okay, get them about that far apart. Let's say that those are two vertebrae there, and let's say my other hand's another vertebrae. Get them in close together there. We'll leave room for the discs. Okay, there we go. So say we got three vertebrae in a row here, and say down towards the floor is to the front of the person's body. An anterior displacement would be where this vertebrae is dropped down like that, towards the front of the body. What you're going to do with an anterior displacement, which I'll show you on Giannis, is you're actually going to push further down on it. In other words, you're going to push this direction. And what will actually happen over the course of the point holding is that vertebrae will actually move back up into place like this. So it started out, can everybody see this? It started off dipped down to the front of the body, and it's actually, which can be very painful and debilitating, and it will actually move up like that during the point holding. Thank you. So if I found one of these, for example, down here, I would press, like let's say this vertebrae right here was displaced anteriorly, I would press like this. I would press down on it, which might be with a thumb like this, or it might be with the elbow like this, and you see how I get my shoulder up directly above it so I could get that pressure straight down towards the front. Exactly. You press, you know, from a common sense perspective, it might seem totally backwards, but it works.
From a chiropractic point of view, you never do that. I asked when I was attending chiropractic college, why? Nobody could answer me. They just said, you don't do that. Well, why can't you do that? Because we were told not to do that. Well, what's the reason that you can't do that? Well, don't ask any questions, just do as you're told. I said, that's not good enough for me. And so I started working working on these spines. I was doing that clear back in the 1950s. And I just couldn't accept that. And so I started working on this very carefully, and in every single case, I've never hurt anybody, but I've just given them no more pain than they can lovingly and willingly endure. And in every single case, that except for some odd deformities, which were genetic in nature, The vertebrae pop right back up in position, just like a little gremlin tapping your elbow from beneath. Let's look at the spine for a moment, Doug. Let's say that you have a back fusion. Oh, excuse me, I'm sorry. Let's take about a 10-15 minute break here.
Okay, wait. Before we do that, I would just like to acknowledge, since they probably won't be here when we finish, the fine work Carolyn and Melissa have done bringing us all this wonderful food the last 3 weekends. So... yeah, they've got a couple on the wall there, maybe 10. Roland? Okay, we're going to spend a few moments here just kind of going over the how to find the STO point, and then what we're going to do, and this is sort of your, I guess, your graduation exercise, is we'll get about 9 or 10 people on the table. I think we've got enough people that have had this held on themselves a number of times. We'll get those folks on the table, and what you need to do is, those of you that haven't held this point before, what you'll need to do is find it on each one of these people in a, in succession. And if you can get it on all of those people to their satisfaction, then you probably could pretty well find it on anybody. It is important that you find it on more than just one person, because everybody's neck is built a little bit differently. You got some people with very long necks and very short necks and no neck at all and that sort of thing. So it's a good idea to find it on a good variety of people. Maybe probably the best thing to do is to actually just, I guess I can demonstrate it on one person up here for the camera, but most of you aren't going to be able to get close enough to where you're really going to be able to see what I'm doing anyways. So we'll do that for the benefit of the tape, and then what we'll do is we'll get some people on the table who've gone through Genazzano, and maybe a few others if we don't fill all the tables that way, and we'll make sure under supervision that you can all find it on these different people. So let's see. Why don't we get? We'll get you back up here, Giannis. You're our stunt man for today. Okay, so the STO point is, you'll remember, is for restoring what in the body? Nerve supply. Good. Okay. And how do we test for that? Okay, the pinch test. So what do you do for a pinch test, Gabby?
Do you check the arms or legs first? Either. Up high here, inside the arms, all the way down to the finger tips. Where's the ouch? And then the legs? Yes? Either or? Or both? Okay. You'd have to do it onto the skin, not through the clothes. On the skin. You alive?
A gentle, sustained pinch. Gentle and sustained.
How's that?
Just like that.
2 seconds. Slower. Okay. How's that? Okay, we got feeling all the way down.
Okay. So basically you're comparing how much sensation they have starting up closer to the trunk and working your way out to the extremities. And if you can still get a good sharp sensation, if you can still get a good ouch, clear out to the tips of the fingers and the toes, then the nerve supply is pretty good. Sometimes what you'll do on a fingertip or in the fingers, you can sort of dig your nail in like that, into the pad and see if you get a good sharp sensation that way, because you may not be able to actually grab them there depending on how much of a nail you have. But basically you can dig into the pad like that, the pad of their finger, and see if you get a good sharp sensation. That's what you're looking for.
Not with the nail. Don't use the nail for the pinch, just the pad.
But you want to see basically how good the sensation is out there. Yeah. Okay, now the name comes from three different structures here. The S, as an STO, is the sternocleidomastoid muscle. Okay, the S comes from the sternocleidomastoid muscle, which is the main muscle on the side of the neck. It attaches. Can you guys see pretty good there on the camera? It attaches up here on the mastoid area, which is basically well behind the ear and going around back towards the occiput. So the sternocleidomastoid muscle attaches where I've got my right hand here on the side of his, basically back up in this area. The mastoid's part of your skull, but it's going to attach back up in this area, and the muscle, which I'm grabbing right now, is going to run along the neck, kind of angling towards the front of the body, and it's actually going to split right here. Can you see that on the camera there? Okay, it's going to split right there, so it's got one attachment right here in the sternum and one attachment on the clavicle. So I've actually got my finger, in other words, it starts up here and comes down here and actually splits in two. And right there, I've actually got my finger between the two portions of the muscle there. It goes like that and like that. But basically, you can really pretty well just grab it right on the side of the neck. It's the main muscle on the side of the neck. What you can also do if you want to find where it is just ask him to lift his own head up about an inch or so, and then the muscle's pretty obvious because it just tenses right up. If you just have him relax and put his head back down, and just put your hand there on the side of his neck, and then ask him to lift his own head up, go ahead. Then it's pretty obvious where the muscle is because it'll just tense right up. Okay, go ahead. Okay, so we got the T, which is the trapezius on the back of the neck here. And then the O, as an STO, is going to be the occiput or occiput, which is a bone. The S and the T are muscles, but the O is a bone. And it's the bone that forms basically the back and the bottom of your skull, of your cranium. Now, what you want to do in finding this point, you want to get you'll probably find that it's easier to find the point sitting down. At least I find it's a lot easier to do this sitting down as opposed to trying to stand up and find it. And you get a person lying on the table like so. Now, if I was actually going to hold the point on him, where the point's going to be up in this area, I would probably, just to actually hold the point, I'd probably have him a little bit further away from me because it'd be more comfortable for me because I'd have more of my arms resting on the table. So I'd get him down like that because, you got to think ahead, and if you're going to be here for a few hours, you probably want to have a good bit of your forearms resting on the table. I would recommend you hold this point with the middle finger because it'll be stronger than your index finger. And because of the angle that you're going to be holding the point on, it's really not, at least in my opinion, it's not possible to do a very adequate job on it with a thumb because the angle is like you're really basically pointing up towards the middle of the brain. I've seen people try to hold it with a thumb. I wouldn't recommend it because it just, to me, seems like it's virtually impossible to get the correct angle that way. So the middle finger is the way to go here. What you want to do is you take your middle fingers like this, and you're going to find the base of the skull, as John would say, since we're in Australia, way down under. Go towards the back there, and you find the base of the skull here first with the middle fingers. Then you want to move off the base of the skull a little bit, somewhere in the vicinity of 1 to 2 centimeters, somewhere in that ballpark. It'll vary slightly from one person to the next, but you're going to move down towards the feet a little bit. And what you'll do when you get way down there, so I got my fingers on the base of his skull there now, so I'm going to move off the base of the skull just a little bit. And I'm typically kind of in between the sternocleidomastoid and the trapezius, kind of like in a little valley there. But you'll find this kind of little groove here down at the base of the skull. So what I'm going to do there in this area is I'm going to press in, press in towards the center of the body, and I'll actually more or less hit the vertebrae. You then back off the pressure on the vertebrae, so you're not really pressing on it anymore, and then you kind of angle your fingers up like that, so you're pressing. I'm really basically pressing towards the center of his brain. So in other words, I've got pressure towards the middle of his body, towards the top of his body and towards the front of his body. So you basically get in there, way down under, find the base of the skull, come off a little bit towards the feet, press in, back off slightly, and then angle your pressure up to the middle of the brain. Like, by away from the skull, I mean towards the feet. Towards the feet. In other words, I'm a little bit off from actually touching the base of the skull. Not much, maybe a centimeter or a bit more, but I'm going to start off by touching the base of the skull, just so I know where it is, then move slightly towards the feet, press in, back off on the pressure, and then point up towards the middle of the brain like that. How's that feel, Giannis? Yeah. Okay, a lot of times, if you really get the point right, the person will start to feel a lot of pressure up in the forehead, but that won't always be true. That won't always be true. But you do point. Basically, you're going to point up towards the middle of the head, the interior of the brain there. That's your basic angle you're going to look at. Now, we got that pretty good on the tape there. Okay, I think we can probably wrap it there.